Good day everyone, my name is Chris Daniel M. Sumawang, a student nurse from Tarlac State University from BSN 1B. And for today, I will be performing hand washing or hand scrub. So the purpose of this procedure is to reduce the number of microorganisms on the hand, also to reduce the risk of transmission of microorganisms to clients, and also to reduce the risk of cross-contaminations among clients, and finally, to reduce the risk of transmission of infectious organisms to oneself. So following the nursing process, we will now proceed to the assessment phase. The first thing that we need to do is we need to determine the client's presence of factors increasing susceptibility to infection and possibility of undiagnosed infections such as HIV. Also, we need to determine whether the client is using immunosuppressive medications. And also, we need to know the recent diagnostic procedure or the treatment that penetrated the skin or body cavity of the patient. Also, we need to know the current nutritional status of the patient. And now we will proceed to the planning phase. First thing that we need to know is the location of the running water, the soap, or the soap substitutes. And next, we'll be assembling our equipment. We do need to have a soap. For this instance, I will be using a liquid soap, and also we do need to have a warm running water, and also we do need to have a disposable or sanitized towels or paper towels. And now we will proceed to our implementation. And for our preparation, first thing that we need to do is we need to assess our hands, and we need to keep our nails short, and if we are wearing jewelries, we need to remove them. And after that, we need to check our hands again for breaking off skin, such as hanging nails or cuts. And now for our performance, if we are doing hand washing and if the client can observe us, and for example, there is a client here, we need to introduce ourselves to the client and explain what we are doing and why is it necessary. So here's an example. Good day, ma'am. My name is Chris, and I am a student nurse from Tarlac State University. And for today, I will be performing hand washing. So hand washing is very necessary to reduce the risk of transmission of infectious organisms to ourself, on our hands, or to oneself, like that.
For our next step, which is our fifth step, we need to turn on the water, and we need to be sure to adjust the flow so that the water is warm. And we all know that there are 5 common types of faucets, and these are hand-operated handles, knee levers, foot pedals, elbow controls, which we use to move this with our elbows instead of our hands, and infrared controls. Motion in front of the sensor causes the water to start and to stop flowing automatically. So usually we see this kind of faucets on the malls. So for our next step, we need to wet our hands and wrists thoroughly by holding them under the running water. Next, we need to hold the hands lower than the elbow so that the water flows from the arms to the fingertips. And for our 8th step, we need to apply the soap to our hands, and we need to remember that if our soap is a liquid soap, we need to apply for about 4 to 5 ml of liquid soap, or is equivalent to 1 teaspoon of soap. And if it's a bar soap or granules or sheets, or we need to rub them firmly between the hands. And for our next step, we need to thoroughly wash and rinse the hands. Use firm rubbing and circular movements to wash the palm, back, and wrist of each hand. Be sure to include the heel of the hand, interlace the fingers and thumbs, and move the hands back and forth. So, the WHO or the World Health Organization also recommended steps in hand washing. So, the first one is palm to palm over the left dorsum with our fingers interlaced and vice versa. Next is to palm, fingers interlaced. And next is the back of the fingers to opposing palms with fingers interlocked. And next is rotational rubbing of the left thumb clasped in the right palm and vice versa. We need to take note to continue this motion for at least 30 seconds. And if our client is a child, it is equivalent to 2 happy birthday songs. And for our next step, we need to rub the fingers against the palm of each opposite hand. And after that, we need to rinse our hands. For our next step, we need to thoroughly pat and dry our hands and arms. We need to dry our hands and arms thoroughly with a paper towel or clean hand towel without scrubbing. So what we are going to do, we are going to use a paper towel for each, one paper towel for each hand. Also, we need to remember to dispose or discard our paper towels in our appropriate container. And also, to turn off the water or the faucet, we need to use another paper towel to grasp the handle of the hand-operated faucet. And that's it. That is all for the medical hand washing. And now we will proceed to the hand washing before sterile skills. First thing that we need to do, we need to wet the scrub brush and apply a liberal amount of antimicrobial soap into our hands and lather well to 2 inches above the elbow. And we need to remember to hold the hands higher than the elbow during this hand wash. We need to let the water run from our fingertips to our elbows so that our hands is cleaner than our elbows. Using a circular motion, we need to scrub all the surfaces of the hand and arm. We need to start with our fingers and scrub at least 10 strokes of each nail and slide on the fingers on both sides of our hands. We need to scrub the arm using 10 strokes each of the lower, middle, and upper areas of our forearms. And also we need to keep our arms higher than our elbows. After that, we need to rinse the surgical brush and reapply antimicrobial soap and repeat the scrub on the second hand and arms. Normally, the scrub takes about at least 2 to 6 minutes. Next is we will need to rinse our hands after washing it. And for our next step, we need to use to dry one hand thoroughly in rotating motion from one fingers to the elbow. And we need to use another towel or a paper towel to dry another hand and the arms. And another paper towel for our other hand. Next is we will be needing another paper towel to turn off the faucet. And also, we need to remember that we need to apply sterile gloves before touching any unsterile items.
And for our evaluation, we need to ensure that both our hands are clean and dried properly. And that would be all for our performance on the hand washing or hand scrub. Thank you.